Universal was presented at an oral session by Dr. Mallinckaudy, and it's a phase 1 study with allogeneic CAR T cells, the first indeed to use allogeneic CAR T cells in the relapsed refractory myeloma setting. The study is being conducted presently at 11 U.S. sites, and the allogeneic CAR T cell is a very interesting CAR T cell product in contradistinction to autologous CAR T cell studies, which have dominated the meetings for the last few years. So the potential advantage to an allogeneic CAR T cell is that this is, quote, an off-the-shelf product, and so readily available, and so it can be given more or less on demand and eliminate the need for bridging therapy between autologous stem cell collection, for example, and the actual infusion of the cells later. Also, with allogeneic CAR T cells, there's less variability of the product, so there's even the potential for being able to repeat dosing. And what makes allogeneic CAR T cells unique is that the CD52 receptor is knocked out in the CAR T cells, so that they can use, as was done in this study, a proprietary anti-CD52 antibody called ALLO-647 to lymphodeplete patients. And additionally, the T cell receptor alpha gene is knocked out, and then that reduces the risk, we think, of graft-versus-host disease as well. Those would be two significant concerns, of course, with allogeneic CAR T cells. So in this study, patients were enrolled in a traditional phase 1 dose escalation fashion, and through doses 1 through 4 planned, and most of the data presented here were across those dose levels. And to be enrolled in the study, it was a pretty typical CAR T cell study. You had to have at least 3 prior regimens, have been exposed to the usual actors that we use to treat myeloma, and you had to be refractory to your last treatment. And these patients were typically high risk. About half had high risk cytogenetics, about a quarter had extramedullary disease, all but one had prior autologous stem cell transplantation, so a pretty typical CAR T cell regimen. With respect to the treatment, patients underwent a pretty traditional lymphodepletion and then were infused, and typically from enrollment to infusion of cells was about a 5-day period of time, so very rapid. And 31 patients have been treated so far. 26 had evaluable data, and that's what Dr. Mallinckaudy presented at the ASH meeting earlier. Patients were treated at different dose levels. The first dose level was 40 million cells, the second 160, the third 320, and the fourth dose level is with 400 million cells. Toxicity was impressively favorable, I think, on this study. And for example, tocilizumab was only used in 19% of patients, steroids in 10% of patients, and importantly, no graft-versus-host disease or neurotoxicity was seen. With respect to efficacy, at dose level 3, the overall response rate was 60%. 40% of the responders had a very good partial response. And of the 6 partial responders who had MRD testing, 5 of those were MRD negative. So I think that the combination of, at least so far, of tolerability and efficacy is very encouraging for the study, which is ongoing. And what we hope to see is at higher dose levels that we'll continue to see better T cell expansion. And we also think that we see higher overall response rates at the higher dose levels as well. So this study is ongoing and still accruing at the 11 U.S. sites.